So we are in week 2 of psychodiagnostics. Welcome. Just an overview on what we are going to be discussing this week. Chapter 3 and 4 in your handbook. Chapter 3 is on interviewing skills. Interviewing skills are very important because just like therapy, there are various techniques that you can follow, but it's always important to be non-judgmental and really convey that you're there to help the person, because that is likely to dictate how honest they are and how much they're willing to share. The main assessment we are focusing on are that of behavioral assessments. So it could be a clinical behavioral assessment or a functional behavioral assessment. Really, the difference is clinical behavioral assessment is something that we could do as MFTs, assessing a kiddo in any type of clinical setting, whereas a functional behavioral analysis is something that is done by the school psychologist, so in a school. Usually you'll see that for kiddos who are in special education or who have, like autism. And really the main reason why we do behavioral assessments is to identify what is causing the problematic behavior to happen, what is the reinforcement, and how might we replace that with something that is more adaptive to their current environment. So you'll read all about that. They're really interesting. I like behavioral assessments, especially if you're interested in working with kiddos. This is a good section to read up on. And for interviewing skills, that obviously applies no matter what type of assessment you may conduct. And I just wanted to take some time and talk about the psychosocial history write-up and what my expectations are for the write-up. It has been a source of confusion in past classes, so I just want to be very clear on what is required. I think this is a fun assignment. I really want you guys to envision yourself really doing this and being in the role of a clinician. Have fun with it. I want you to identify someone in history that is interesting to you, that you know who had mental health problems. There's a link right here just for easy access to people. And you can also, I will allow you to use someone who is alive and is still in the media and maybe is open about their mental health experiences. You just need to make sure there's enough information on them. So you're going to write up a case history, viewing it in the lens of the checklist on page 87. So it's on 87 in your book. I've also provided a link here. So that is this. And these are the types of things you're going to be looking for. Again, you don't need to get all of these things. So if you don't find information on all of these, that is okay. I know this is a little bit vague, but you just need to use enough information to really conceptualize the person and their background. So it's really a judgment call. If the information is there and available, by all means, use it and plug it in to the write-up. But if it's not, that's okay. These are just examples and things you could look for. If there is not enough information, so if you feel like your report is lacking something and you can't find any information easily on that person, then, say that you don't have enough, you don't feel like you have enough personal history on their infancy and their maybe like attachment style or how they grew up. And if you want to, I'm giving you permission to fabricate and add details that aren't necessarily facts if it's going to enhance your report. Again, judgment call. I'm not going to go through and see if these are verified facts. The whole point of this assignment is for you to practice, and I want to assess whether you're understanding what comes with a psychosocial history and why it's important. So I'm flexible with that piece. It should be overall 3 pages, not too long. And I gave you 2 really good examples So I'm going to pull those up. So literally you can use this as a template. So you could copy and paste it and just plug in your own information. As far as formatting goes, APA does not apply to psychosocial histories. It's not a protocol, so don't worry about it. You can use a heading if you'd like, but no need. So it's really basic, honestly. Their name, their highest level of education, their date of birth. So you could see here that this example is on Marilyn Monroe. Their gender, the reason for their referral. So what's the reason why they're being assessed? It's clear here that she has some big things. She has suicidal ideation. She has depression, anxiety, and make sure to mention how it's affecting and impairing various domains of her life. So, or him or her's life. So if they are reporting that they're so depressed that it's affecting their ability to be present at work and, they're on the brink of being fired, that's something you would write there. You want to make sure that it's showing that their life is impacted by this mental health challenge that they're having. The presenting problem, the difference here is the difference between the presenting problem and the reason for referral. Presenting problem is really just maybe what the precipitating factor was. So do they feel it's getting worse? You could make sure to use some of their language here. You could, if you want to quote them, you could just use quotes, but you can include why this person is seeking support now. Whereas the reason for the referral, it's just basic objective here for this, and that. You're going to want to report if they're on any medications. So current psychiatric medications. Psychosocial history, this is going to be your longest section, especially if the person you're using has used or has lived a full life. You want to maybe pull out different things in different stages of their lives, but it can't be random facts. There has to be continuity, and it has to all relate to their mental health somehow. Academic history. So how far did they come in their academics? Where did they go for their academics? How did they do in their academics? Employment history. So history, work history, and whether their mental health, whatever they're reporting, did it affect their ability to work? Medical history. So this is, their physical health, and whether it's something separate from the mental piece, if it's like they have scoliosis or asthma, you could put that here, and you could also include somatic symptoms. So often we see anxiety or depression have physical symptoms, and you could write that here. You also could state things about, usually what I like to do here is talk about their sleeping and eating habits. If they've had weight loss due to depression or weight gain due to depression, or if they have insomnia because they're depressed, you could put all of that here. Substance abuse. So are they on any substances right now, and what is their history with it? If they have nothing, you could simply write no substance abuse reported. Same with legal history. So if they've never been involved with the law, you can write no legal history reported. But, if they have any legal issues, that's something you want to note. Psychiatric history, what have they done for their mental health? Have they had any therapy? Have they been hospitalized? This is where you would include any diagnoses. So if they've had a diagnosis in the past, you can also talk about whether they have experienced like a 51, if they've been on a 5150, or who they're currently seeing to get their prescribed medication noted above. So anything related to psychiatrics, that would go here, and family psychiatric and medical history. So obviously we know that certain diagnoses can be genetic and run in the family or not. Sometimes there's no history of that, and that's okay, but there's probably going to be something. So, mom has a history of bipolar depression and was institutionalized, has been, has a history of 5150s, or also medical history. So if there's, cancer that runs in the family or migraines that run in the family, you could include that here. Again, for purposes of this assignment, if you can't find much on that piece, no big deal. You could just add something if you feel like it will contribute positively to your psychosocial write-up. The second example is the same, it has all the same information. It's just a little bit of a different formatting. It's a little dated, and you'll see why in a minute. But if you'll notice here that it has a spot for test administered, and it also has a spot for test taking attitude and observations, the test results, diagnostic impressions, and summary and recommendations. So this would be, that doesn't apply to this assignment, so don't worry about that. But I just wanted to show you what it would look like. Say you did administer a test. So say you were doing a clinical behavioral analysis and you conducted one, you would write what test you did here. You would do the psychosocial write-up, which is all the same thing that we, the same type of information that we just went over. And then the difference was you would add what you observed their test-taking attitudes to be. So if they were really guarded or resistant, or maybe they were very animated about it, and also your observation. So if you noticed any maybe abnormal behaviors that they had during the assessment, that would be good to note here. And then the actual results. So these are examples of what maybe results, what you would be reporting based off of your test. And diagnostics impression, it's dated because obviously we don't use Axis 1 through 5 and the GAF score in DSM-5, but that would be, say you were giving say you were a school psychologist. So again, we don't, as MFTs, we don't have this ability, but if you went to school to be a school psychologist, you would report the diagnosis. So say, okay, I'm going to give the diagnosis of autism or ADHD. That would go here, and also a summary. So overall, the student is exhibiting this, and that. Therapist is recommending that student receives weekly behavioral therapy and speech therapy. And that would be it. So again, those extra sections don't apply to this assignment, but it's just good to be aware of what that might look like. So that's pretty much it. If you have any questions, do not hesitate to contact me. This is, like I said, this is a good assignment because it gives you a really good practical experience with it. I'm really excited to read yours, and I think you all will do really well, and I'm wishing you luck, but I'm here to support you every step of the way.